Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can see some important points for your exam. And these important points may helpful for your coming interviews also. Here we can see the points. Today's important points firstly from musculoskeletal system. It is number of bones and where it is present that we can see first. Total number of bones in human body is 206 and in case of infants it is 213. An axial skeleton consists of 80 bones. Axial skeleton includes skull, vertebral column and thorax. It consists of 80 bones and skull consists of 22 bones. Vertebral column which contain 33 bones. So each part is important. Total number of bones and the number of bones in infant. Axial skeleton consists of how many bones, that also important, that is 80 bones. Skull consists of how many bones, that is also important point, and vertebral column consists of 33 bones. All are important points, and the vertebral column consists of 33 bones. They are cervical 7, thoracic 12, lumbar 5, sacral 5 and finally coccygeal bone 4. Okay, so that all total 33 bone in vertebral column. Total number of muscles in the human body is 639 total number of muscles in the human body. Next important points from sites of injections. Sites of injection means intramuscular injection is there, intradermal injection is there and subcutaneous injection is there. So where we can give the injection, that we can see in that first one is intramuscular injections. So intramuscular injections we are giving in dorsogluteal site, ventrogluteal site, vastus lateralis and mid deltoid. Here we can see first is dorsal gluteal site. How we will identify the dorsogluteal site is, first we have to identify the greater trochanter of the femur and the posterior superior iliac spine. Then we have to draw an imaginary line between these two bony landmark. Okay, and the site will be usually in the upper and outer quadrant. In short, the buttocks is divided into 4 regions by an imaginary line and the injection is given in the upper and outer quadrant. Okay, that is the dorsogluteal site. And the next we can see ventrogluteal site. Here the tip of the index finger on the anterior superior iliac spine and middle finger just below the iliac crest and make a V mark, and injection can give safely in this area. Okay, that is ventrogluteal site. That V shape we have to remember over here. Next is vastus lateralis, that is the site is lateral aspect of the thigh. And the next site is mid deltoid. In this mid deltoid, usually very small quantities of injections are given in the deltoid area. Usually non-irritating drugs are given in this area. Most of the IM injections are given in the gluteal site, that is dorsogluteal site is the preferable site for giving injections, IM injections. And next is the subcutaneous injection site. Subcutaneous injection means injections like insulin, heparin all giving in subcutaneous route. The subcutaneous injection sites include outer aspect of the upper arm and posterior chest wall below the scapula, that is on the posterior back side, and upper front side, that is anterior abdominal wall below the breast to iliac crest, and anterior and lateral aspect of the thigh. This is the area for subcutaneous injection site. Next we can see intradermal injection site. Usually test dose and all we are giving in intradermally. So the sites we can see inner aspect of the lower arm, upper aspect of the anterior chest and upper aspect of the posterior chest. So here the intradermal injection site, while we selecting this injection site, we have to know the skin area should be healthy and free of irritation, swelling, edema and discoloration. Otherwise, it will affect the test result. So so far we discussed intramuscular injection site, subcutaneous injection site and intradermal injection site.